While mankind takes pride in achieving technological breakthrough that enabled it to take a plunge on the moon and beyond in the outer space, still millions live in good Earth in dangerous conditions. One of those hazards to human life is called dracunculosis, or guinea worm disease, which is in fact a very ancient disorder. About 50 million people in Asia and Africa are living at the risk of acquiring this infection. Pakistan is one of the countries where about 500,000 people are living dangerously in Bannu, Dera Ismail Khan, Dera Ghazi Khan, Sangar, Tharparkar and neighboring regions of these districts, vulnerable to this disease, which is primarily the outcome of poverty. It occurs in remote rural communities that lack adequate water supply and depend on rains. People in these areas depend on the rainfalls, and water is collected in the reservoirs, cisterns, ponds, or tarais as we call them in Sindh. Narwa or Vareji Bimari, as it is known in Pakistan, is spread by drinking contaminated water. And leaves deploring effects on health, agriculture, education, and quality of life in the area is affected. The disease can immobilize people for months. The energetic young people, who in most cases are the bread earners for their families, are knocked down by this disease. And suffering among affected population. Transmission of these in most situations corresponds to the harvest season. Thus adversely affecting the harvesting of crops and adding another blow to the already under-stressed communities. One can imagine adverse effect it leaves on agricultural output and the overall economic growth. The worm, as you see here, is a white string-like parasite that burrows through the patient's muscles, and a subcutaneous tissue before it emerges through a blister in the skin. It can grow to a length of 1 meter and makes movements so painful that victims cannot walk or work. Although the parasite itself is not fatal, it can cause lethal secondary infections and severe allergic reactions. This disease is spread only by drinking water contaminated with infected cyclops. A small shrimp-like crustacean. About a year after a person has drunk the contaminated water, 1 or more mature female worms up to 3 feet long emerge through the skin of the lower leg or any part of the body, causing an ulcer. When larvae are discharged into the water, it affects cyclops and restart the cycle. The irritation from the mature worm emerging through the skin causes severe local pain, swelling, and sometimes arthritis. The ulcer, which is caused by the mature worm's emergence, usually becomes secondarily infected, causing additional disability and sometimes death. There is no known drug that can be used to treat the early infection. Prevention of infection by the guinea worm is the only way to avoid the discomfort related to this disease. The key to eradicating this menace is the provision of clean drinking water for people in areas where guinea worm disease is prevalent. The Pakistan Institute of Health has launched a guinea worm eradication program in collaboration with Global 2000 and BCCI. This program includes chemical treatment of water reservoirs, filtration of all drinking water with special filters, and health education of the affected. Survey teams that visited the affected areas have observed that those who drink water after boiling it or filtering it in some way are not affected by the disease. One of the preventive measures is the spray of contaminated ponds and other sources of water in these areas. To kill cyclops in the ponds, tanks, reservoirs and step wells, the insecticide called Tempifos is effective and safe. Chlorine or iodine is also used to chemically treat the drinking water to kill larvae. Most important is to educate the public and make them aware of the importance of boiling or filtering of the water. Besides treating the water sources in these areas chemically, the inhabitants are being provided with special filtering equipment and cloth so that they can be safe from the Guinea worm.